the members that are here on site, if you will, since they can't see us, state your name as you're making comments so everyone will know. And also for the people who are joining us virtually, if you will also state your name when you speak so that we also can connect the voices with who is speaking. Sorry about this today, and we're going to work through these kinks and hopefully be back in business by next meeting time. So with that, for the sake of time, we will go ahead and start the roll call.
Mr. White?
Here.
Representative Oliver? Representative Hall? Senator Weaver?
Here.
Senator Beasley? Senator Coleman Madison? Mr. Brannon?
Here.
Mr. Jones? Dr. Anderson? Mr. Schmidt? Ms. Phillips? Dr. Studstill? Ms. Benson? Ms. Price?
Here.
Mr. Kirkland?
Here.
Dr. Marshall? Dr. Hart? Mr. Morgan? And Mr. Dean.
Great. So seeing that we have a quorum, we will move forward with our meeting. Thank you all for being here today. A little bit chilly in here. We're going to see what we can do about that too. Thank you all for bearing with us today as we work through some of these kinks. As we look at old business, actually, Vice Chairman Brannon, do you have any comments that you would like to make before we get started?
No, ma'am. Thank you so much. Appreciate it. We're good.
Very good. So since we last met, we've had a lot of work that's taken place. We have had subcommittee meeting that you will hear the report from here in just a little bit from Chairman Studstill. One of the things that I also want to follow up with in old business is the update from Board of Nursing related to the discussion with what's the official term for Marty Redden's office? The office, OIT. Yes. So there has been work done in communication with OIT in discussion related to the database that Peggy has discussed. And according to Marty, he thinks it's a very reasonable request. And Peggy, do you have anything else that you'd like to add to that? Mr. White?
Thank you for checking with Mr. Redden. I think highly of his work. So thank you, Peggy Benson. Thank you, Chairwoman.
So given that discussion turned out favorably, the previous discussion of this task force related to that database will stand. And we will continue on with our thoughts related to that as we move forward. Other old business, we will continue to have our subcommittee update, and at that time, we'll ask Mr. Morgan to come up and give us some discussion related to the subcommittee report, if that's okay with you, Dr. Studstill. I'm going to go ahead and ask Nick Moore to come up and give us a very brief update on the talent triad, and then we will go into subcommittee report after that, if that's okay. Thanks for being here with us today.
Good morning, everyone. Got the team from EBSCO with me today, Mr. Greg DiDonato and Kristen Delwo, that will give us a brief update about where we are in the development of the pilot, a little bit about our timeline and next steps. And I've got a leave behind I'll give to you that you can take and peruse over Thanksgiving break that just gives a little bit more of a breakdown of what is a learning and employment record and how theoretically does this work to connect traditional education records to different forms of learning people may have had outside of the classroom. So if that's okay with you. uh, Greg, could you hear us?
Yes, sir, I can. You hear me?
Yes, sir.
Okay, perfect. So I'll go ahead and share, Nick, if you'd like, the PowerPoint that we put together for the meeting today.
Yes, sir. And I'm not sure what our capability is to share a screen, so we may just want to do a verbal update today.
Okay, perfect. So as far as an update is concerned, and I'll share just so I'm speaking to that specifically, just in case you can see anything. We are in the process of completing the gathering the student data. That student data will be coming from ACCS, both for traditional age college students as well as adult age college students. Be coming from ALSDE, and we're also currently working with the Office of Apprenticeships as well. So we're in the process of finalizing that. We are completing the job descriptions and getting that ready for posting as well. So that will complete 2 of the 3 of the pieces of the talent triad. The third piece being the Alabama Credential Registry, but all is looking well for it to be a first quarter launch of 2023. We're going to look to push as fast as we can for early 2023 within the early part of the first quarter, and in order for that to be a successful launch. At the present moment, what we're looking to accomplish is identifying those graduates earning the credentials and the skills in the 7 areas of jobs that we've talked about for healthcare, specifically certified nursing assistant, registered nurse, phlebotomist, respiratory therapist, EMR, EMT, paramedic, pharmacy tech, and dental hygienist. Once we receive all the final student data, we're going to look to intentionally match those candidates with the skills and either who have earned the credentials to meet those specific jobs or on track to meet those specific jobs, so that both sets of candidates can be seen by employers, and also so those candidates can also see those opportunities as a part of their current pipeline or future pipeline of opportunities on both the employer as well as the student side of the house. Ultimately, the goal is to expand the opportunities that are seen by both students as well as employers for outside of your traditional job postings on Indeed and other networks, by exposing the skills that are relevant to those jobs, as well as the certification requirements that are part of those jobs. We look to expand those opportunities for everybody to look for employment, as well as to look for candidates to continue the pipeline into those fields. So any questions specifically around the timeline or around those aspects for our current pilot?
Ms. Benson?
And this is Chris Schmidt. I heard certified nursing assistant and I heard registered nurse. I definitely agree on the medication aid, but the number one position that the nursing homes need is licensed practical nurse that we're missing. So if we could add licensed practical nurse to the job descriptions and on the site.
If you could
So-
send us the job descriptions for those, we'll make sure to get those to the team.
We sure can.
Thank
Yep.
you so much.
So just so I'm confirming, I heard medication aid and LPN as the two additions. Okay. Okay, thank you very much.
Peggy, just
Yes.
that one other question.
Nick.
What about
Um,
apprentice? Okay, just want to, okay, making sure we didn't miss that one too.
Any other questions? Mr. White?
Thank you, Dave White. So how are potential employers going to be matched? What's the mechanism? Is there a website? How are you going to communicate between who's available and who's might be hiring?
So I can answer that question. So the current opportunity will be launching via Alabama Works. That solution will have both the employer as well as the student wallet as well as the employers for the job description generator that will be available to them. So through Alabama Works, the employers will be able to register. As a part of the pilot, we're going to be preloading that on your behalf, but the employers will be going through Alabama Works and the students will also be going through Alabama Works. So both solutions will be available in the same location.
Thank you. And a follow-up, please. I take it Small Business Association and the Business Council of Alabama, and as well as the education groups, all know about this and are going to be told, hey, this is wonderful, go check this out.
We are definitely meeting with groups and raising awareness, and certainly any connections that folks would be willing to make for us here would be much welcomed. Yes, ma'am. Thank you.
Any more questions related to this exciting project?
This is Ken Kirkland. I don't know if you can hear me.
Yes, we
Can't,
can.
just somebody wave at the screen. I heard the word apprenticeship mentioned a minute ago, and I can't see the room to see which member had mentioned that. But with apprenticeship, the school helps align those employers with the potential applicants. So I don't know that they're going to make it into the pool where they're going to the job board and necessarily looking, because the apprenticeship's just a different type of recruiting process.
Mr. Kirkland, you've been quite the television star this week too. I have seen you on a lot of different news stories talking about apprenticeship programs. So exciting that you're getting that word out as well.
Yes, ma'am. It's National Apprenticeship Week, so I just we're very blessed. Thank you.
Any more questions? Nick, thank you so much.
sorry.
Did you have another question?
This is Greg DiDonato from EBSCO again. The other part that I did want to announce while we had everybody today is that the state of Alabama was awarded a grant through the Walmart Foundation to continue our evolvement of this solution and to specifically work with employers to gather feedback to continue to evolve the Alabama Talent Triad to make sure we're meeting your needs. That work will also begin in January as well, and we'll continue that through the first half of the calendar year. So we certainly will be reaching out to the different employer groups. We'd love to have everybody's involvement in developing that, both from an industry perspective as well as from a state perspective. So did want to make that announcement that certainly within the state of Alabama and beyond the state borders, that these programs are getting national attention, and key funders like the Walmart Foundation are supporting the efforts to continue to evolve this solution. So um, definitely looking forward to additional support and creating those cohorts between January and March.
Well, that is really exciting news. And I'm happy to support you in any way that you need support. And I'm sure this task force will as well. So whatever you need from us, just let us know. Ms. Benson?
Thank you.
Any other questions? Thank you so much for being here with us today and give us this update. It is amazing to me the amount of work that has been done in the last few months and how far this project has come. And I just want to thank you for everything that y'all have done to help make this a reality and look forward to seeing the next few exciting months ahead.
Thank you, ma'am. And it's an honor to always come before y'all and appreciate the work you're doing. And just hate that we're a bit behind on this, but we're looking to get in earnest. And then we kind of hit a period of time where we're hitting the holidays. So we thought it's probably better to get it launched at the beginning of a new year rather than try to launch it in the middle of Thanksgiving and Christmas. So appreciate y'all's patience. We want to get it right so that it's something that really can make a difference. And with any kind of software solution you build, you always run into a couple of change orders along the way. So I do appreciate your flexibility.
Well, again, I can't tell you how much we appreciate you working with this group and hearing our thoughts on the needs, and look forward to having a recap from you again after the first of the year, talk about progress and to hear about the rollout. So thank you again for being here with us today.
Thanks. I hope everyone here has a great Thanksgiving.
Thank you
Thanks,
all.
Nick.
I'd
Appreciate
pass
your time
this
today.
out if you don't mind.
Sure. Thanks again. We look forward to seeing you again very soon. So one thing that I missed, I got so excited and getting started that I forgot the approval of the minutes. I skipped right over that.
Motion to approve, Jeff Brannon.
Second, Chris Schmidt.
Okay, so I have a motion for Mr. Brandon, second for Mr. Smith. All in favor, say aye. Any opposed? Okay, so the minutes from last meeting are approved. And with that, I will continue on with the agenda. And at this time, I will turn it over to Dr. Studstill to tell us a little bit about the subcommittee. And if you will, do you want to introduce our next guest since he goes along with your subcommittee, or do you want me to do that?
Thank you, Madam Chairwoman. We had a really informative, interesting, and productive subcommittee meeting last week. Marcus Dempsey and Patrick Dean met with us from ACES, Alabama Commission on Evaluation of Services, and really enlightened us about what that group does and how important it is to make sure that the effectiveness of boards that the state puts money into, how that goes about, and how that money is how they look at how effective those organizations are. So I think they have a presentation this morning, and after they make their presentation, then I'll talk a little bit more about what our subcommittee report was about. Is that okay?
That's perfect. Mr. Morgan? Absolutely.
Appreciate the opportunity to come today. Appreciate the opportunity to get part of the subcommittee discussion. There is a slideshow that we'll go through, but you also have it in front of you. So I'm not going to read the slides to you. I'm just going to talk about
before I get to that, I'll tell you a little bit about the Commission on Evaluation Services. Some of you are already aware on our commission, but the commission was formed in 2019. Got a specific charge of advising the governor and the legislature on the evaluation of services. So as staff of that commission, we conduct evaluations, performance evaluations, program evaluations. Results from those evaluations are findings and recommendations. We bring back to the commission, and they decide whether they take action. So, real quickly about the evaluations. When we scope evaluations, or when we come up, we try to look at 4 key areas. Program efficient, is it effective? Number 3, is there sufficient collaboration between entities trying to accomplish the same goal? And then is there sufficient capacity to deliver the program for evaluations or build our objectives? We're looking at those criteria. And happy to answer any questions about the next slide, please. So last year, we completed 2 evaluations dealing with medical professionals. One is the medical programs that covered 4 programs. Second was addressing provider shortages in rural and underserved. Got some QR codes there. If you want to go find the reports, you also have them in front of you. And if you don't like any of those, you can go to our website, evidence.alabama.gov publications there. All right, I want you to know where our work is. I want you to go find it. So, but these 2 evaluations were completed last year, and interesting key takeaways I'll discuss with you today. Next slide. So with the scholarship and loan forgiveness program, specifically the loan forgiveness program, that those programs that were tied to service commitments. So you receive a loan and in repayment of that loan, you would go serve in an area of need. The effectiveness of those programs, specifically those programs, the other scholarships, small merit scholarships, so they were effective. They were handed. But specifically to the loan forgiveness programs, we found effectiveness to be kind of all over the board. It really relied on some key things. Was the area of need defined? Was it too broad or was it too specific to determine effectiveness? The loan amount, was it sufficient enough to drive demand for that loan that a medical professional would, instead of paying back, say that loan in cash, they would actually go to the area of need to serve in an area of need. In the quantitative metrics, the weighted areas of need, that's what I talk about when are they defining, are they too broad or that's something that we found could impact the effectiveness of the program. If it was broad, of course it was effective, but was it accomplishing what it was intended to do? If it was too specific, it could really get medical professionals to go serve in an area of need. An area that wouldn't support addressing provider shortages in rural and underserved Alabama. There is no shortage of funding that's going to $32 million, a little over $32 million in fiscal year 21, our evaluation period. $32 million between federal and state funding going to programs provider shortages. There's also public-private partnership between Blue Cross and Blue Shield that started, I think, 2016 and state. I think $7.4 million that's been handed out in that partnership. Again, to address providers. In addition, next slide, please. There's even more opportunities that are being missed because we lack the staff, dedicated staff to go after federal funds and programs. There's competing programming. We have a go after the one that has the state match. Just let that one go. There's a lack of knowledge that these federal programs even exist. So these are the kind of the explanations we got for why the federal funds are not. So if I leave you with really one takeaway, and I've probably talked too much and I'm losing my perspective. If I leave you with one takeaway, and this is a recommendation that we really try to give our members and everybody that we go through, can you define success? How do you define success? How do you measure success? Are you going to collect data on a regular basis to measure that effectiveness in the short, mid, long term? So whatever policy decisions y'all come away with from this task force, this subcommittee, or committee as a whole, I hope you would take those two things into consideration. And preferably before they get off the ground is how will you define success? How will you measure? And after the fact, those are the questions that we're trying to answer. There is another slide, last slide, something that I wanted to also leave you with other considerations. Existing community resources can be a significant issue. We found that when we were doing our evaluations, is that getting somebody to go serve in an area or no other service rather difficult. So the areas most in need aren't being reached. Certain medical professionals are depending on others. Often partial service commitments may allow for special populations to be served. So the loan programs that we looked at were basically all or nothing. You went and served full time in an area of need for a period of say 3 to 5 years. But what may be an option is partial service. So 2-3 days a week, certain number of hours, certain number of populations that you serve with that nature. Geographical limitations, not based on need, limit impact. So I'll leave you with that, and if you have any questions, happy to answer them.
Dr. Coleman Madison.
The first bullet point, existing community resources that can be significant issues. And so you mentioned that the areas of most need may not necessarily be getting service. Have you looked at any way that we could deal with that? I mean, because you're getting right down to the crux of where we are. And is there anything that using technology, telemedicine, which is what we're looking at, that can address this or fill that gap somewhere?
We didn't get into the specifics of those things. What we did was really the deep dive evaluation was the scholarship addressing provider shortages came out of the work that we were doing for that evaluation. So we didn't get into any of the specifics. There's a myriad of programs specifics of understood what so no we haven't, but it is something that we consider the work with the dental optometric for the strength of the legislation. Something that came up find these areas of need. We also have to take into consideration some economic feasibility for doing that. Why is that? It's something we talked about, but we didn't get into solving.
So one of the opportunities that we have, and we're so excited that he's here to tell us today about some of the things that he can help us with, is once we define some of the things that we really want to focus on, we can utilize their group to really do a deep dive to say, what are we missing? How do we get there? So I
You
think,
can go right
okay. You know all about this.
to the board of nurses.
scholarships, that's scholarships. But we realized that we need to take that back to the have an access clinic within that 5 minutes. That is a huge critical need, but we don't allow them to participate in the loan. So how do they continue to staff that if they can't even had some dissatisfaction for those applicants because they don't qualify based on the way we worded it. Graduated. I think there's things that we need to look at and maybe take some revisions to that. Obviously, I've been talking with my staff about it. One of the things that came out from your review is we are going to pull out all of our loans so we appreciate all of it. And we had some takeaways from that from these two.
See, I think that is the perfect example of what we're trying to accomplish, of taking these things that are existing and how do we make it better to define it to reach the goal. So,
Because we're new to this and we've not been doing it very long, so we've learned some things. And it's time to say, okay, this is not working the way we intended. So
thank you for your willingness to look at it in that way, and I'm excited to hear that and look forward to hearing updates on that. Any other questions for Mr. Morgan? Thank you for being here with us today. I can guarantee you we're going to be reaching out to you to help us look at defining some success measures and some outcomes on some things that we identify. And I'm so excited that your group is there as a resource, and just know that we're going to be reaching out to you for help with this.
Thank you. Look forward to it.
Thanks for being here. So Dr. Studstill and Mr. Schmidt and Mr. Kirkland, I can't thank y'all enough for serving on the subcommittee and for working as hard as you did to help bring that information full circle back to us. Do you have anything else that you would like to add related to any of that discussion?
Yes, ma'am, if I could. The subcommittee talked about mainly, of course, we were talking about dentistry as a main focal point, but really the overall look at what's happening as far as how can we attract healthcare professionals to go to areas of need. And one of the things that we're really interested in dentistry is really a rural pipeline program, identifying young men and women in rural areas and high schools that might have some bent to go to medical school, dental school, especially dental school in our case, and really fostering a relationship with them in high school that would end up in some type of college program before they get into college, and a summer type program. And eventually they would go to college, and eventually they would end up having that set aside entrance into dental school if they meet all the criteria every step of the way. So this is a way to really attract people to get into areas of need, and really they would, if we could get people who come from small communities that really need a dentist, and then help them to get into dental school and help them to be qualified to get into dental school and then graduate. They go back to where they grew up. This is the best it can be, because they know their community and they're going to be dedicated to their community. So that's the rural pipeline program that we're talking about. Would be the School of Dentistry working with the College of Community Sciences at the University of Alabama in Tuscaloosa. And that program already has a medical segment that's been very successful. And we feel like if we could have our program just like that, having some funding that would allow the School of Dentistry to work with the community, the College of Community Health Sciences in Tuscaloosa, that would be really the first big step to get that going. So subcommittee was supportive of that and voted to support that. And hopefully find some way to get some funding to the dental school to work with the College of Community Health Sciences in Tuscaloosa. And then a second thing that came out of this last discussion that I'd like to add, the dental school also the dean has a concept of a spoken wheel concept. And the spoken wheel concept is that the spoke is at the School of Dentistry with the students and the clinical faculty that are there. But the real interesting part of that is that the wheel concept, and there's a first rendition of that at the Hersink Ophthalmology Clinic in Dothan, Alabama. Dr. Hersink has made space available in his ophthalmology clinic for a dental clinic. And they're going to put I think there are 4 dental units down there in his clinic. And then that will be staffed by residents and clinical instructors from the School of Dentistry and junior and senior students. So this is the first of many, we hope, around the state that will really put students, residents, and faculty taking care of people in need who don't have a dentist. And then the students are going to get the training they need. And we hope from that, maybe some of those students who are being trained in that area will see the need in that Southeast Alabama community and say, hey, I'd like to come back and practice maybe in Southeast Alabama. So it could be Southeast Alabama, it could be Northwest Alabama, it could be North Alabama, all over the state. So the dean's vision is to put these clinics in several different places. So those are 2 exciting possibilities, Madam Chairman, that I think that will be really interesting to follow. And the Alabama Dental Association is going to put its full force behind doing that, working with the legislature and working with decision makers in the state. And I'll be happy to answer any questions or make anything else you'd have me do.
Absolutely. So I think the appropriate thing for us to do is to consider as a full task force some of the motions that you're bringing from the subcommittee with your recommendation to evaluate the rural pipeline program. Was that the only recommendation or was there another one?
Yes, and we recommended, the subcommittee recommended that we seek state funding for in the neighborhood of $345,000 that would actually be a direct line item budget to the school to work with the College of Community Health Sciences in Tuscaloosa as a seed money to get that program started.
Any discussion on that for the full task force? Mr. White?
Yes, ma'am. Thank you. Is the leadership at UAB or UAT agreeable to this? Is the president or their lobbyist agreed to put this in their request?
Well, they've been, Dr. McKenzie, who's the chair of the admissions committee at the school, and Dean Teichman have had direct talks with the dean down in Tuscaloosa. So they're ready to go, and they have a broad outline already ready to go. And just what they need is some funding to really get the program going. Did I understand your question correctly, Dave?
And so, Madam Chair, it seems reasonable to me that before you guys are asked for money, that the University of Alabama leadership say we want it.
So maybe the motion should be that we would support their request.
If they come with it.
Yeah. I would say that would be the form of the motion would be that we would support the consideration of the rural pipeline program and also to support any requests that they would bring forward related to creation of the dental, what's the word that you used? I'm sorry.
Rural dental pipeline.
Rural dental pipeline program.
For clarification, so as I understood what you were saying, and you correct me if I'm wrong, that there should be a collaboration between the existing schools of dentistry as well, that, you know, there's a support for this project. Was that?
Yes, ma'am. If the money's going to go to UA but working with the dean at dental at UAB, but it'd be good to know that the leadership of UA and UAB want this money and they ask for it. If it's in there, does that make sense?
Because they have clinics in in rural areas as well that they may be able to assist.
Or whatever the money ask is, I would suggest that instead of having a dean ask for it, have the president ask for it. Does that make sense? Because they're the ones who file, they're going to file a budget request with the finance director and then with you guys, right? And so if the president's not on board with it, then why do we do it? Is my question. I'm just raising the issue. Would that make it easier for you guys to support on the floor if you know that the chancellor for UA or their presidents are for it?
I think it would for me because that's a head.
Yes, sir.
It's my understanding, Dave, that the dean has already talked to at least the provost, and I'm not sure if the chancellor or not, but he certainly had the go-ahead to talk to the people down in Tuscaloosa. But we'll be happy to do whatever it need to do to get that funding going.
Okay, so.
By the
again,
way, the dean and president and all those folks were in Dothan when the announcement was made at the hearing. So I think they're aware of it and supportive of it.
So was that in a form of a motion that we as a
Be happy to
board
make that
would
motion.
support
Yeah,
the request of the subcommittee?
yes, I'll make that motion.
Motion by Mr. Brandon. Do I hear a second? Second by Senator Coleman Madison. All in favor, say aye.
Aye.
Any opposed? Okay, thank you so much for all three of you and your work.
Thank you.
Anything else related to that we need to have a discussion with today? That was good. Thank you for your update. New business. Anyone have any new business for the subcommittee today? So I would like to go ahead and also reemphasize my thought related to the presentation that we saw today from ACES and Mr. Morgan. And I think as we go forward, we get into the thought of how we will define success and how we will measure it related to all of these programs that we currently have in place in the state. So as we move forward, I hope that we'll all work through or think through how the best way for us to define success is, and also your thoughts on how we move forward in getting there and measuring it. So as far as a meeting goes in December, just in some discussion, I think it's going to be very hard for us to get a quorum in December because typically we meet towards end of the month. It's right in the middle of the holidays. So we will not meet in December. We will be sending out a date that we will meet in January. Over the next month, we will continue to do work with LSA to gather information of national best practices, how legislation is being formed to address some of these issues in other states, and other information that they are already working on pulling to bring back to us. And also we will, I'll get with Marcus to see what other information ACES has available that they can also bring back. And then as we look forward to identifying other projects that we feel is important for them to help us with, we will then invite them back to continue the discussion related to that. Does anyone else have anything else for the good of the group today?
I had
Mr.
one.
Schmidt?
I was wanting to get an update as far as we're talking about LPN standalone programs and helping the community colleges, redevelop those. And I know they were given around $2 million or something like that. And we talked about increasing that. And I was wondering, had we made motions or had we made any progress on increasing that? I know we were trying to increase that or double it to 4 million or something like that. And this is around standalone LPN for community colleges. It was kind of.
Spencer, do you know? I'm not sure what the answer to that is.
Oh, yeah,
I have a meeting with following what we want, have that break before they transition on and apply for the RN course program. Had a couple hiccups with that, so maybe some misunderstandings allow them to continue on,
Right.
and that was not the intent. need more
Yeah,
money. The
okay.
2 million was supported.
Okay.
The
Mhm.
application.
All right.
So if you could bring us an update for that at the next meeting, would that be something that would be helpful to you, Mr. Schmidt?
Yeah, it's, like I said, we're, from the nursing home standpoint, that's our number one, need is registered nurses important, but LPN, we're not making it without the LPNs. And now we've got the community colleges rethinking that, doing standalones, not just bridge right to RN. Our main middle management workforce is LPN, LPN, LPN. And so we're making the progress, and I, I want us to keep moving that forward. And if we can give more incentive to the other schools that have not done it, not restarted their programs, that's kind of what I'm trying to bring up and do.
So some of the things that the Board of Nursing did practice for the LPN, you
Mhm.
allow them, the training has changed over time for concept-based required that they keep that concept assessment. We're going to let LPNs start completing comprehensive assessment. And another thing that we're going to allow LPNs to start doing is stable patients. They can start doing the care plan. These are things that RN has always been responsible for, and this will help the workforce, especially in the nursing home. Always required an RN training in the comprehensive validation. Because we know that education programs
Is that a smile I see on your face,
Yeah.
Mr. Schmidt?
I'm good. Thank you.
Madam Chairman,
Absolutely.
I just really want some guidance on this issue I'm about to bring up. Don't know if it's something that I could bring to this task force, but in lieu of the student's death in Selma, just last week or this week, to talk about the rescue medications needed in our schools with the synthetic opioids and marijuanas and things like that. So to have 4 students affected by that, and they were able to save the lives of 3 of those students and the demise of one, I would really want to, and I don't know if this is an issue that I could bring to this task force, but there has to be something that comes together to address the issues that are now not just in our communities, but are now right there in our schools. And to have a student die right there in the cafeteria, I think that there are a lot of issues that are going on, but we really have to gather together and all hands be on deck to protect our children. We're about to lose a whole generation of children because our issues, and I'm not saying any other issue is not important, but the priorities have to change and help us, the school nurses, to have the naloxone, the Narcan, the medications, the rescue drugs. And so we don't really have legislative laws that mandate things like that. And that is an issue that I would love to bring, or if it's not an issue that this committee would want to consider, but something down the line that will help to prioritize a reversal of to have that medicine on board to reverse the effects of the opioids and the fentanyl that we're seeing, not just in our communities, but now directly in our schools, even on our elementary campuses. So we're really trying to generate a program to stock Narcan in our elementary, middle, and high schools. So if this is not an appropriate situation or to bring it before this task force, if you can give me guidance.
I
Who else?
appreciate you bringing that up today because it is such an important subject. And even though it might not be related to workforce, you got 4 ears right here that heard you loud and clear. And I know Senator Coleman Madison and I have both worked on legislation related to things like this before in the past. And I would love to have more conversations with you about that. And if we could work on that in a bipartisan effort.
It's a great idea because, we look at first responders already given to an extent, in particular, they have access to it to save lives, and they have talked about, how it's made a incredible difference well, you know, you're there in a situation where, well, well, deaths would have been caused had it not been for. So, well, I think it's something that we can.
Yeah.
Receptive ears. at least.
Absolutely. Absolutely. We would love to talk to you about that later. Thank you for bringing that up. Mr. White.
Senators and representative on the phone, you guys will probably be presented with recommendations by the Opioid Council, Alabama Opioid Overdose and Addiction Council, on how to use any settlements from opioid lawsuits. That was addressed yesterday at the meeting, and they approved their recommendations that they're going to make in their annual report to you guys. And one of the big ones is increasing distribution of Narcan or naloxone. And so I don't know what kind of money we're talking about because I didn't hear an exact number from Attorney General Marshall. But you guys, I'm hoping that it'll be a situation where the governor looks at it and maybe makes a recommendation, but ultimately you guys are going to decide how you spend that money, if indeed it's available for this fiscal year.
Thank you for
Yes,
that
ma'am.
update. Mr. Brandon?
Just want to make just a point of clarification that you asked earlier of the committee to be thinking about measures of success. Do you want us to put that in writing to the task force?
I think if you have ideas that you want to share with us, if anyone has.
Give it to Caitlin.
Give them to Caitlin, and
Okay.
then we'll put them all together and before our next meeting, and we'll bring them back and start the discussion.
Well, the
there.
reason I'm asking that is our hospital association workforce task force meets December the 1st, right, Stephen? So again, that we'll be looking at opportunities to put things together there as well. So that's all I wanted to say.
So anything that you have related to that subject,
Sure.
bring it. We'll start it as a topic of
Sure.
discussion of how we go, because I think things like that are what we're going to have to do, because, you know, it's easier to say we need money for this or we
Right.
need money. But I think from this task force and this group, they're actually looking at, or would probably like to see, how do we fix it currently with the money that we have allocated?
Right.
Do we just need to reallocate, or do we need to define it different instead of saying, you know, we need more money? So I think looking at those success factors and definitions are going to be key in what we're able to bring back.
Okay. Thank you.
I'm sorry, but real quick, National Health Service Corp. Federal has been doing this for a long time, loan forgiveness programs for service in underserved areas. And I see Ms. Purser over there with LSA, and they do incredibly good work. And of course, ACES does good work, but maybe ask one of the two, hey, do they have any analyses on effectiveness? They've been doing it a heck of a lot longer than we have. And some states have too. The problem, I think, is going to be, how do you prove that someone wouldn't have moved somewhere underserved anyway without the forgiveness? How do you prove that the forgiveness actually was a motivating factor? That, I don't know how you answer that. I don't know how the feds answer it. I don't know how we answer it. But maybe there are some studies that the National Health Service Corp could be useful because they've been around a long time.
Good thoughts. Thanks for sharing. Any other questions, comments? Yes, ma'am.
I need to apologize to the committee. I think last time I was on the conference with you all, I was trying to get my car service. I do apologize.
Well, we didn't even know.
Well,
I wondered who that lady was giving that guy the business as far as all good.
I hear it in the background. She says, "Hello." I forgot.
Well, thank you for being here
Thank
today. Anything else for the good of the group? Hearing none, I hope you all have a very Merry Christmas next month. Hope your holidays are wonderful. And we will regroup after the first of the year, and we will send that note out with that date as soon as we have it. Thank you all for being here today.
Oh, good. How are you?
Well, this actually